Now we'll be discussing what is known as antenatal corticosteroids. So, from the knowledge I have from my pharmacology days, the steroids are basically a type of drug that you use in handling all those inflammatory conditions of the body. Okay, so if I say antenatal, that's you are giving steroids to a woman before she actually gives birth. Do you understand? So you might now be surprised, like, okay, what type of corticosteroids can we give to those women that will be tolerant and that will be able to tolerate it, and why are we giving them? Okay, so antenatal corticosteroids, we said that they are a cornerstone of modern obstetric care, especially for pregnancies that are at risk of preterm birth. So if a woman is at the risk of giving birth to a child before the time of the child, you can actually give what? These corticosteroids. Okay, so they are not just a precautions, they are a powerful intervention that can dramatically improve the neonatal outcomes. So what are antenatal corticosteroids? So they are steroid medications, and especially you are talking about betamethasone and dexamethasone. Okay, these two types of corticosteroids. So is these two types that pregnant women happen to tolerate them the most. Okay, so why are they used? They are administered when there's a risk of preterm delivery. So if the woman will give birth to the baby before the time of the baby, you can actually give these drugs before time. Okay, so between week 24 and 34 weeks of gestation. So though they may be considered as early as 23 weeks or late as 36 weeks, depending on the clinical circumstance. So they help to now stimulate the lungs to develop better, reduce the risk of the baby having difficulties with breathing later on. Okay, lower the chances of intraventricular hemorrhage, necrotizing for enterocolitis. Then ultimately they lower the risk of the baby dying. So timing and dosage is 2 doses of betamethasone, 12 milligrams intramuscular. Okay, 24 hours apart, or 4 doses of dexamethasone, 6 milligrams intramuscularly every 12 hours. So it's most effective when birth occurs 24 hours to 7 days after the second dose. So benefits is it reduces the risk of respiratory distress syndrome, reduces the risk of the baby dying. Okay, then all those bleedings. Okay, so that's intraventricular hemorrhage, that's IVH. So consideration, a single repeat course can be considered if preterm birth risk persists after 14 days after initial dose. It's used in multiple pregnancies and late preterm births. Okay, that's 34 to 36 weeks. Okay, it's generally safe for the mother. So that's why they actually picked this dexamethasone and betamethasone, because particularly they are effective. Okay, and they are very safe for the mother and the baby.